David,
What's that?
we talk a lot about the fact that we are a level 1 trauma center at Cardinal Glennon.
I don't know what that means. I know it's important, but I don't know there's a couple of different numbers at the hospital.
Well, I looked up the actual definition the other day of what a level 1 trauma center means. And there's a lot of criteria, but essentially, if you are a level 1 trauma center, you are capable of providing total care for every aspect of injury.
Okay.
From prevention through rehabilitation.
Oh.
That's what it says. And
wow.
I feel like when we talk about the fact that we're a level 1 trauma status or center to people, it's usually through a lens of what we can provide in terms of the injury, right? And treatment. And, the fact that we're open 24 hours a day and we have in-house coverage by general surgeons and quick access to specialty services and things like that and critical care. But the prevention piece is also part of that key criteria. You're supposed to be a leader in prevention and provide public education to your surrounding communities.
See, and I think this is a very important I hope shift that we're seeing in healthcare, because I remember whenever I was a kid, it was almost like reactive medicine. So it's like, oh, you have a cold, you should do this. Oh, you broke your arm, you should do this. But I think as we've been seeing more and more, there's been a lot of talk about preventative medicine, from wellness things to try and keep you healthy. And as we're seeing, the differences between people getting sick and unfortunately passing away from diseases and violence, I really hope that we do continue to shift our mindset more to that preventative mindset instead of a reactive mindset.
For sure. And you know me, I definitely feel that if you're a healthcare provider, that you have some level of responsibility along with the patient in helping them manage their own health. I think both parties have a responsibility to doing that in and out of the hospital,
Yeah, well, and I would imagine that prevention in adults looks a lot different than preventions in kids, right?
For sure. I don't know. I don't know all the 3 leading causes of death in adults or anything like that. But if you think of a lot of the things that you hear out there, why adults are dying, cancer, heart disease,
right.
Stroke, things like that, prevention probably comes more in terms of healthy diet and cancer screenings and, smoking cessation and, things like that. But with kids, I was actually looking up a few statistics. Did you know that for kids, that accidents are the 3rd leading cause of death in the United States in all age groups? Yeah.
Number
for sure.
3.
As far as just injuries go, just in our St. Louis area, 20,000 kids a year are injured from those unintentional injuries, those same things. So there's a lot of incidents going on.
That's way too many. Well, so I guess that's why we have 2 very solid programs at Cardinal Glennon dealing with preventative injury and related matters. So we have our injury prevention program at Cardinal Glennon that's out in the community, and then we have our hospital violence intervention program,
right,
which works with those patients after an injury has taken place.
We sure do. We have both. And both of those programs are truly dedicated to keeping kids in our communities safe, injury-free. And these amazing humans, they're not just doing that, but they're really contributing to the overall decrease in the rate of childhood injuries and mortality rates in both babies and kids. And I don't know, these 2 people that we're going to have on are probably 2 of the most passionate advocates, most giving people, some of the smartest people, and fun people I've ever known. They really
and highly caffeinated to keep them going with what they do.
For sure. They just feel their work to their core, and I think it'll be a miracle if they can actually sit on that couch and talk to us for a length of time, because they just don't sit. They're not sitters. They're always out there in the community, moving and shaking all the time and doing amazing things. So we are going to have Lori Winkler.
Love Lori.
Yes, she's amazing. She's our injury prevention nurse coordinator. And then joining her will be, they run 2 separate programs, but their services overlap a lot. And they've become amazing friends and partners in their work. And so our second beautiful human joining us is Melik Coffey, and he is the program manager for the Life Outside of Violence program.
He's so awesome. We probably ought to just mention quickly for listeners and viewers that we're going to have some sensitive topics discussed in this episode, specifically related to gun violence, trauma, potentially abuse, and especially happening with pediatric patients. So just want to say that in case that is a sensitive subject for any people listening, to make sure that they're prepared. Yeah. Well, let's dive in.
Let's do it. Welcome, you two. We have Lori Winkler, who is our injury prevention nurse coordinator for SSM Health, Cardinal Glennon Children's Hospital, as well as Safe Kids St. Louis Coalition. And joining her on the couch, we have Melik Coffey, who is the program manager for the Life Outside of Violence program. Welcome.
Thank you.
Thank you.
Thanks for being here today. We thought we'd have a little bit of fun. So we have an icebreaker prepared for the two of you.
We haven't done this in season 2 yet,
No,
so
this
we're
is
excited.
The first time
You're
in
our
season
pick.
2.
We're in trouble.
You're our pick for the hot seat.
Yeah, we put the two of you on the couch, which we like to call the hot seat.
Okay.
So I'm going to do a series of rapid fire questions back and forth to the two of you. And so quick answers are kind of the name of the game. Are you both ready?
No.
No?
No.
That's okay.
We did not prepare you for this.
Yeah, this wasn't on the outline.
It wasn't on the
No,
outline.
this is
No.
fresh. Okay. Melik, what does Lori hate?
Be careful.
Ooh. Who hates such a strong? Can we say dislike?
What is Lori's least favorite thing?
I don't know.
There's a lot.
There's a lot.
Be careful.
I know. She doesn't like warm Dr. Pepper.
Warm Dr. Pepper? That's a good dislike. Lori, what annoys Melik?
Asking to be Santa Claus at a community event on the spot.
You don't like playing Santa?
Ooh. Yeah, that's a long story.
Melik, what's the best takeout spot?
Joy. Is it Joy? How do you say it, Lori? Joyous?
Joyous.
Yeah,
Joyous?
Joyous sandwiches.
Oh, good segue.
Gross.
Yeah. Lori, you're around the hill neighborhood. What's the
am.
best Italian restaurant?
Favazas.
Favazas. Okay.
No hesitation.
I know.
No
That was a
hesitation.
quick one.
They treat me like royalty.
Well, you are royalty, Lori.
Yeah, I get by proxy royalty.
Oh, hey, well, maybe you can go there after
But
this.
the best bakery is Missouri Bakery.
Oh, I've had those chocolate drops. They're delicious.
Look at her putting out the commercial over
I
here.
know.
Okay.
Well, let's get a call from them. Melik, what's the song that always gets you on the dance floor, no matter where you are?
I don't know. Probably Beyonce's version of what's the name of the song? The remake that she did.
I don't listen to Beyonce.
Well, that song.
she's
It's
too
the
All right.
song. Yeah.
The Beyonce song. Okay.
Yeah, the Beyonce.
Mhm.
Anything by Beyonce, honestly.
Okay. Lori, if you could have dinner with any celebrity, who would it be and why?
Oh, I got to think about this. Bruno Mars.
Bruno Mars.
Ooh.
Why Bruno Mars?
Because he could just sing me right through an enjoyable dinner.
There you go.
And
Okay.
make my heart happy.
Oh, that sounds great. Melik, if you were a superhero, what would your superpower be?
Invisibility.
Invisibility?
Yeah.
You'd like to just go unseen?
Yeah.
Okay. All right.
It's kind of like being a therapist.
Oh.
You kind of get the writing behind the wall.
Oh, I think we'll get to that later.
Why are you getting all the easy questions?
I could. You know the name of the Beyonce song, Before I Let Go, or Before I Let You Go?
Before I let you go, there's the
Yeah.
song.
There it is.
Lori, if you were stranded on a deserted island, which 3 items would you want with you?
My Diet Dr. Pepper. My Diet Dr. Pepper. No. So definitely my Diet Dr. Pepper.
Seeing a theme.
A blanket. Because I don't know if it's going to get cold.
It might. I don't know.
And
It's
then
a
maybe
deserted
some
island.
snacks.
Some
Just
snacks?
snacks. I don't need solid food. Just I could live off snacks.
Okay.
Chocolate drops.
Okay. Well, you've officially survived the hot seat. It's finished. Thanks for playing.
See? It's going to be an easy podcast. We're
I
good.
don't know.
Watch out, Melik.
Yeah.
I have a feeling we're going to get drenched with water or something. They've got some trick up their sleeve.
Like
That's
a
at the end.
Nickelodeon moment. Like,
Right. Slime. We're going to get slime.
oh my goodness.
Okay, these are going to be easy questions, the next ones. Okay, Lori, we're
Yes.
going to start with your why. Tell us about your background and what led you to do the work you're doing now.
So I actually started as a paramedic for the city of St. Louis. So my involvement within the community, I was going into people's homes at their at their most vulnerable state, if you will. And unfortunately, I loved that job. I never got burnt out. But unfortunately, I sustained a career-ending injury. So I was too young to retire. So I had to find a new career. So I became a nurse. So my clinical area of expertise, I worked in emergency departments, both adults and pediatrics. But I really loved being in the community. And I really didn't mind taking care of sick people because I felt it was a calling. And when I went to find a home, if you will, SSM's mission statement and what we do and how we serve our community really aligned with the way I was raised. And so, unfortunately, this thing called the electronic medical record, which means computers, came into play, and I am not very technologically savvy. And so I wasn't able to give 110% of my full attention to my patients and families. So I became an educator. I felt as though I was busy looking through the flow sheets and, doing things like that. And I wasn't giving my all. So then I became an educator, but then I missed being in the community. That's where I love being in the community. So when this opportunity came to be for me to become the injury prevention nurse and be the Safe Kids St. Louis Coalition coordinator, I jumped on it because prevention is key.
I love that. All right, Melik, what's your background? What's your why? What led you here?
I have to follow that. I got nothing.
Got nothing.
I am a licensed clinical social worker by training. And so when I originally was in grad school at WashU, I was like, yeah, I want to do something, right? But somehow through the course of my career, I landed with youth. So I've worked as an individual and family therapist. I've worked with youth who were unhoused. And a lot of my work started to just kind of converge around trauma and just kind of some of the social determinants of health that set a person up to experience trauma, and looking at how early onset of trauma and childhood set someone up for either more success or more barriers to success. And then I was doing that work and I was like, I got kind of the 3 knocks, so to speak, to come to Cardinal Glennon. I was like, I don't know if I want to be in a hospital setting. And I definitely didn't have any thought about doing anything around community violence, right? Those were just not on my radar. I was like, I'm a therapist. Treat kids, treat families, work on trauma. And so somehow there became this intersection between doing that and then doing that in a community-based setting in relationship with a hospital space. And so 3 people were like, hey, you should take this job. I was like, Second person was like, And then the third person was my mother-in-law. And at the time I was a new son-in-law. And I was like, well, I got to kind of get a little extra cool points in here. And so I was able to come to Cardinal Glennon to do work around community-based violence through our Life Outside of Violence program. And that was like 6 years ago now. So, and once I got here and really understood the culture of Cardinal Glennon, I was like, this is probably the best place I could have ever been. And it just felt like alignment. Whereas other places in my career felt like a job. Yeah.
Wow.
I get that.
That's really cool perspective.
Mm-hmm.
So, Lori, the injury prevention program, it's not something that it's new. It's been around for a while, but can you kind of give us like the overall 30,000-foot view of what the program is, maybe how it's changed over the years, and then what the overall goal is for the injury prevention program at Cardinal Glennon?
So, excuse me. When I started in this position about 10 years ago, Cardinal Glennon is the lead agency for Safe Kids St. Louis Coalition. Safe Kids St. Louis Coalition, as well as other coalitions, their main goal is to reduce unintentional injuries by bringing forth education and awareness, because we know that unintentional injuries are the leading cause of death in our children under the age of 19, and the majority of these deaths are preventable. So at that time when I started, we served, if you will, 6 counties. But when I looked at the literature and the research, when I started, I was like, well, wait a minute. If you're telling me that unintentional injuries are the leading cause of death in our children, and in the state of Missouri, there's 114 counties plus the city of St. Louis. And there are a lot of counties that have none of these resources to serve or to keep their children safe. I was like, why don't we expand our coalition? So we went from 6 counties to, I believe we have 13 counties. And so we cover the southeastern section of Missouri. We go all the way down to Cape, and we go up to St. Charles, St. Charles County. So what we do is not only do we provide educational classes, we also provide the resources, because it is my thought process and my belief that if I educate a family and make them aware, but they still don't have the means to purchase or to get the resources that they need, really and truthfully, I'm setting that person up for failure. Because if you don't have it and you don't know you need it, that's a whole different story. But if I educate you and you still don't have the resources that you need. So with that, our program, what we do is we're a very small program. There are 2.5 of us, if you will, that work 2 full-time nurses. And then we have another nurse that works 20 hours a week. So with that, we teach our classes. We also do car seat inspections and installations, but we also distribute car seats to our families, our most vulnerable population. Again, trying to address these social determinants of health that Melik had talked about, getting that access to care, having them have what they need to raise a safe and healthy child.
Oh, that's awesome.
We also do community events. Like, you never see me. Well, you can if you go out in the community. From about April until November. Well, sometimes even December. We're at at some community event every weekend.
She's never gonna let me live this Santa Claus thing down.
Never. Just tell it. Never.
That's the December
That's
event.
the December thing, yes.
We're going to hear about that at the end.
Yeah. So, Melik, kind of a similar question. So when did the Life Outside of Violence, or the LOVE program, start at Cardinal Glennon?
So the idea of like a hospital-based violence intervention program is not new. There are national programs in cities that experience community violence, particularly in cities that you think of like Baltimore, Chicago, Oakland, right? But in 2018, and I say that because there was a lot of work that was done before we actually launched. But in 2018, we launched this hospital-based violence intervention program here at Cardinal Glennon in collaboration with the other 3 level 1 trauma centers. It's the only program of its kind that is a regional approach and that works across 2 healthcare systems, and it encompasses 4 level 1 trauma centers, 2 of those being adult and 2 of those being pediatric. So when that program launched in August 2016, the goal was to provide comprehensive wraparound services to individuals as young as 8 all the way up to 30. And so on the pediatric side for Glennon, that's usually our 8 to 18-year-olds. And we provide wraparound services for individuals who've had an incidence of community violence, particularly assaults, stabbings, or gunshot wounds. And it kind of runs a spectrum of like least severe, which is your assaults, all the way up to a gunshot wound, right? We see the assault side being a lot heavier on our pediatric side because, again, that's our kiddos who are being victims of bullying, maybe had like some type of fight, or like I always say, some type of assault significant enough for a parent to bring their kid to the emergency department, right? Which I know I probably would have put a pack of peas on a black eye and stay home. But so those are our more severe assaults. And so what we do is we provide mentorship, therapeutic services, so that's where the clinical piece comes in. We have licensed clinical social workers. We're wraparound, so we're community based. We start with our patients in the emergency department at the time of injury, but then we follow them from the emergency department if they for some reason are hospitalized, and then back home and then in school and other safe community spaces to provide them with that support. They get therapy, they get mentorship, we do school-based advocacy, we connect them with other community resources, because the idea is to kind of weave a layer of support underneath them so that they can reestablish healthy connections within the community. In addition to that, they stay with our programming for anywhere from 6 months to a year. And again, that's weekly visits, that's family therapy. We're addressing those healthy coping tools. So do they know how to manage their anxiety? Are they having onset of trauma symptoms? So we're screening for PTSD or things to mitigate it moving forward to more stress. A lot of our kiddos who qualify for this program, this is not their first experience of trauma, because again, they may come from communities or neighborhoods where they hear gunshots. They've already been exposed to some type of traumatic incident or event. So we are highly conscious of that, and we're intentional about removing barriers, which is why we don't just bring them back to the hospital. We actually go to them to make sure they get access to this service and support. There's someone who also similar at each of the other hospitals, and then they work cross collaboratively to support patients across the grid, I would say. So it's kind of a good example of working across the aisle.
So Life Outside of Violence, that's just the name for the program that encompasses the St. Louis region with that partnership of the 4 hospitals.
Correct. Yeah.
Okay, so I'm going to ask you both a question. Same question, dual question. I'm going to start with Lori. So the first part of the question is, why do we need you? And what I'm getting there is, give us the background, like you talked about accidents being the biggest cause of death, right? Up in kids under 19. And then also, why is getting out there necessary? In other words, like you hear on TV, gun violence is an issue, or you hear, I want to know why the overarching campaigns that are out there don't work, right? Why just hearing that it's a problem doesn't work. So first, tell me about that, being the leading cause of death. What are some of the things we're talking about? How bad is it here in our region?
Actually, unintentional injuries, especially gun violence right now, has surpassed being the leading cause of death in our children, which is so unfortunate. It used to be motor vehicle crashes, all right? However, because of advocacy, because of child passenger safety laws, having car seats, making sure we are able to assist our families or making sure that children are in the correct car seat, has reduced that incidence of so many motor vehicle crash fatalities. People do not listen to the news. The audience that we need to adhere to these recommendations, if you will, and to really focus on how to keep their children safe. They're not listening to the news stories. I have a son that's 32. He's like, I don't listen to the news. It's too depressing. So having people such as us, such as Melik and I, being in the community, being that support system. All of my moms, all of my caregivers, when I teach a class, they have my contact information, and I get phone calls and text messages. Do you think this is safe? Is this safe? What can I do about this? I get them all of the time, because if you think about it, our patients and our families, a lot of them are lacking that support. Sometimes I feel as though I'm just a glorified mother, if you will, or a grandmother. I kid around that I have so many grandchildren, which really I have 0, right? But I've all taken that interest, if you will, or their children are my children. And if I have touched their lives in the sense that they reach out to me, we've developed long-term relationships. And I know as part of our vision to be present, okay, there's 2 words, presence and devoted. And that's exactly what Cardinal Glennon aligns with. You have to be present in these, in our families' lives. They know, they understand if you're present, and if you really are devoted and committed, really and truthfully, they're going to build that trusting relationship with you.
Sure.
Did I answer your question?
Yeah, you did. Okay. Now, Melik, it's interesting because you said that the Life Outside of Violence program is the first of its kind that kind of crosses healthcare systems, involves these academic institutions. So why here, do you think? Is our region more affected by gun violence? Talk about the statistics and, why this was such a need here in our own community.
Yeah. So life outside of violence, or love, right? Or that's what we're more affectionately known as love. If I could show you the back of my t-shirt, it says showing STL some love, right? Because again, one main challenge here, which makes the work that we do so unique, to Lori's point, is that Cardinal Glennon is about the healing power of presence, right? And our program truly is mission work. It's mission power. I could tell you all the things I learned at WashU as in my social work program, and all the therapeutic tools and treatment modalities I could pull out. But my best tool every single time with those patients and their families is showing up. I countless kids who are like, you keep coming back, right? And so what that is an extension to what we're seeing as a community. And so what Cardinal Glennon did by investing in this program, being a champion for this work, really showed that as a hospital, they weren't just going to be geographically located in a zip code, but really embedded in a community and becoming a partner for the community and becoming an extension. I think that's a huge piece about why we don't just stay inside of the emergency department, right? Like, our program lives in the community. We engage with the people who support the people that are trying to recover. And a lot of times when I talk about this work, we're saying we're asking someone to heal where they've been harmed, right? To send you back home to your neighborhood where you've incurred this injury with the expectation that you should recover, right? And I think what a lot of the smart people here at Cardinal Glennon and at the other hospital partners realize is that it's a healing journey. It's a journey that requires support, and it's one that requires somebody to walk with you, right? And so I think Cardinal Glennon and the other hospitals were able to leverage the idea of becoming a part of that because of the challenges we have in our community. Across the nation, it's not crazy to think, our young men of color, are at higher risk for dying by guns than their white counterparts, right? They are more vulnerable. We know socioeconomic factors play a role in that. We know that lack of community resources contribute to that. And those are all things that we have at play here in our St. Louis city and in our St. Louis region. And that's what Love does. We support St. Louis City, we support St. Louis County, and now, even because we recognize the need, we've also extended our programming to Illinois, because again, we recognize there's just some gaps in services that we've been able to critically support.
Have you had in either of your lines of work, when you're out there in the community, had people surprised by the fact that you go as deep as you do with them? In other words, are they surprised at the level of presence that you do provide? Like, kind of like I was saying before, there's information out there. Hey, we have a problem with this in St. Louis. Hey, we have, have you had people say, wow, you really care. Like you're here,
Yes.
holding my hand through this.
Yes. Yeah. I think that's what makes our programming and Cardinal Glennon's approach to injury prevention and this level of engagement so much more in tune with the community, because it's heavily embedded in community, the component of community, asking the community, what do you need? How can we be with you? And for us, we're a hospital-based intervention, right? So while Lori is focusing on prevention, we've already moved to the point where you say people are not listening to the news. They're not catching these preventative pieces, which is why our program is actually an intervention, right? Because now we've moved past the ability to prevent it because it's happening, right? And we've seen it ebb and flow. This program's been in existence for about 6 years now, and we've seen it ebb and flow. Some years, like around the pandemic, we saw an increase in gun violence. So there's a lot of reasons. There's a lot of hypotheses. I'm sure the CDC is going to be rolling out statistics as to why that happened. But again, people were isolated, which we would assume would have caused less gun violence. But our teenagers actually were at higher rates. And we saw higher numbers of kids injured by gun violence during a time when the world was shut down, so to speak, right? So we know there's a problem. We know we have the awareness. And I think this is one of those creative ways of just not saying, hey, we're going to send you home with some referrals. Hopefully we get you connected to some support, but basically saying like, we're going to make sure we're barrier free. We're going to put you with a licensed clinical social worker so you don't have to sit on a wait list anymore. So we're not going to send you and wait 3 months to get connected to a therapist. We're going to come to you. So now if transportation is a barrier, we've eliminated that. And then we're not going to ask you to come back to the hospital, which in some ways at the early point of injury can be re-traumatizing. We're going to come to an environment where you feel safe, where you feel able to start and be a part of that healing process from very point of injury. And I think that's that intentionality that sets us apart.
Well, and Lori, kind of like you said too, there's no point in telling them what the resources are unless they have access
Exactly.
to them
Yep.
too.
Exactly.
You know,
And that's the one thing, and I share this throughout the community at every class that I teach, is that people, when you look at prevention, it won't happen to me. That's the mindset. People think, oh, that will never happen to me until it happens to them. I.e. Melik's intervention, and stepping back a little bit on the gun violence in our area, we had actually just this year, there were select states that were offered an opportunity to address gun safety by Safe Kids Worldwide, which is the overarching national or global coalition leader, which they have never done. So they selected states, which is embarrassing because, of course, Missouri was one of those where the gun violence rates were so high. So they were able to offer scholarships to provide, or not scholarships, I'm sorry, grants in order to provide, gun locks as well as gun safety education throughout the state of Missouri. So we do have a problem, with our gun violence.
And I think to Lori's point too, I mean, we've seen an increase to where firearm related injury is surpassed other things, right? And we can say, well, we've got car seats, people are using them. But again, that just speaks to the layer for statewide, right? And it's, again, who is being impacted? It is our young boys, right? 90% of the kids that I've worked with in the 6 years that I did the work were boys, young boys, teenage boys. They were mostly people of color, young men of color. So we kind of got a pulse on who's being impacted, right? Which then helps us to better identify the right strategies for engagement.
But now we have the increase in suicide. And I think in accordance to with what Melik was saying about during that COVID, not only did we see an increase in gun violence, but also intentional injuries. And unfortunately, our children are getting younger and younger and younger, verbalizing and acting out on, these negative thoughts of suicide, if you will. There's a lot of mental health issues with these children. And unlike before, they would, my boyfriend broke up with me, so I'm going to take some pills. They're not utilizing that option. They're going straight to a firearm, which we know the results are instantaneous and 98% of the time are fatal.
Mm-hmm. Mm-hmm.
And I think a lot of that suicide, suicidal ideations and plans and successful suicides came during COVID as well because of that self-isolation. Sure. Not only in children, all the way across the age spectrum, but I mean, we're a children's hospital. So
right.
Yeah, right.
Let's talk about kids.
Let's talk about kids, right?
I know so you've seen a lot of things in both of your lines of work. And Lori, I know you've kind of touched upon some of the community resources that you have, that you get to host, if it's classes or events that you have. Can you kind of, can you talk us through kind of that list of those educational resources that you are providing out in the community, be it those classes or those consultations that you're doing to help bring that safety, prevention, and awareness directly to the community?
Sure, David. So as I stated earlier, we're a very small department. So we rely heavily, heavily, heavily on collaborating partners.
Yeah, you've got 2.5 employees,
we have
right?
2.5 employees in our team, right? But I know, exactly. So in order to do what we do and make a difference, we really do have to rely on our community partners. And a lot of our community partners are also part of our coalition. So, for example, our police and fire departments, if you will, a lot of them serve as a child passenger safety or a car seat inspection station. So we provide them with the resources, and they are currently trained by Kim, my coworker, who is our car seat child passenger safety technician instructor. So they're currently trained car seat technicians, but yet we then provide them with the car seats so that, again, access to care, social determinants of health, having people that live way at the extreme part of the city or the county to come all the way down to Cardinal Glennon to get a car seat, it's not going to work. They are not going to be able to do that. They may not have a vehicle. They may not have, the means. They may not have gas. They may not have a support person to do that. So putting our resources and our education in the communities where our families live is crucial in order to get positive behavior change and to have those resources. So we have them and we align with them as well. So with that, we went out because unfortunately, when we were looking at the infant mortality rates in the state of Missouri, unfortunately, our babies under the age of 1, the majority of them are dying from accidental suffocation and strangulation in bed. So how do we keep our babies out of their caregivers' beds? Well, let's educate the fire department, because our fire and our police, they go into these people's homes so they can see if there is a need. And so training them as safe sleep champions, providing them with a safe sleep environment in that firehouse that is close within that person's community, we're going to, again, be able to provide those resources. So we offer a baby safety class. We also, which focuses on all the risk areas, but with a huge primary focus is on infant safe sleep, because most of the parents that take this class are expectant mothers and fathers and grandparents. Oh, which that reminds me, things have changed since old people such as myself had our children. So really, we needed to guide our focus and direct our focus on our grandparent age, because we know our grandparents are being the ones that are being held responsible to be the babysitter or the child care provider. Unfortunately, now with they're becoming foster parents, like kinship foster parents, like from the emergency room, you need to come pick up your grandchild. They don't have the resources, and we don't want them to follow the recommendations that I did 30 years ago with my son.
I was going to say,
things have changed.
They're also a very influential voice
and
on their children.
Yes,
Voice.
Absolutely.
Mm-hmm.
So we do offer a baby safety for new parents and grandparents class. I always encourage and invite grandparents to attend. We, instead of participating and partnering with our managed care healthcare organizations for community baby showers, where we have games and we have, gifts and we have snacks and stuff. Well, we've now added an educational component. So part of that is like during their eating time, whether it be a brunch or a lunch, it's like a lunch and learn. So I do the safe sleep education. We still do the games. We still have the food. We still provide the resources. And then working as far as with the gun violence, making sure that we have, thanks to the hard work of the foundation here, being able to pursue us to get some funding for our adult ministry emergency departments. We have our No Questions Asked Gun Lock program, which I'm very proud to say that we at Cardinal Glennon are the ones that pretty much started this whole thing, that where we don't ask. We don't want to know any information. If you need a gun lock because your firearm is unsecured, we have them located in all of our adult emergency departments. We have them at our behavioral health urgent care. We have them throughout all of our hospital. Our physicians, our pediatricians are asking at every visit. So again, it's bringing in those key partners to help us get this message and get these resources in the communities.
For sure. Okay, buckle up for a minute, because we're going to brag on you.
Oh,
all right. We know you never sleep. We know you never sleep. And we know you have you and your 1.5 other people helping you do all this work, right? But there was a report that you probably had to submit to us, I don't know, sometime this year, about 2023 statistics. So on that report, it cites that there were 57,634 adults and children provided injury prevention, education, and safety resources in our community. 57,000.
That's a large number of people.
So I'm going to go through some of the breakdown on this, and feel free to step in and throw in some commentary when you see fit, okay? So as far as safety equipment distributed, 627 car seats distributed, 3,036 gun locks distributed, 1,198 home safety items distributed, 898 bike helmets distributed, 173 pack and plays and sleep sacks distributed. That is just the safety equipment.
That's a lot of individual pieces.
Right. Now let's move on to
Takes a village.
Programmatic activities. 1,137 car seats inspected. 63 child passenger safety technicians trained. 1,040 injury prevention consults. And, this is my favorite, 572 community events. That's a lot of work.
Now you understand why nobody sees me
I
except
know.
at a community event.
I mean, I
from
might see
April
you at
until-
Deerberg's once
You
in a
might.
while shopping, but
we've made the joke, like, I do quick math in my head, but 572 community events, there's only 365 days in a year. So how does that work?
she ain't here. She's out there.
No, I know, but that's almost 2 events per day.
But that might not be just me. That may be like my coworker Kim may
Your
have,
other 1.5 coworkers.
right? Or we may have a volunteer. Somebody like I will reach out to our pediatric offices, for example, off site here. There's a back to school. My mindset is like this. These are your physicians. These are the people that are caring for your child in this community. So you need to be in an environment that is not a negative environment or a threatening environment.
Right.
Okay. Be in a positive environment. People go to community events on Saturdays and Sundays. It's something fun to do. So pulling our physicians and our staff from, say, for example, one of our pediatric offices to go to this back to school fair, that alleviates me or allows me the opportunity to take another event somewhere else. And then they are becoming familiar with their clients in a non-threatening environment. It's a fun environment. So there was one thing I used to hate when I worked in the emergency department, and I still hear it occasionally, like the parents sometimes would come in and say, now, if you're bad, I'm going to tell them to give you a shot. So it really puts that fear in that child of, even as soon as they see our beautiful Cardinal Glennon son, they're crying. And it's like, no, it's a son. It's good. We're happy here, And so, trying to do and provide education and awareness and just being there, being present, okay, in a fun setting, I think we get better adherence. Hopefully. I don't know. And yes, I do stalk pregnant people in Walmart, but those don't count. Those aren't counted.
Those aren't on the list.
Those aren't on the list.
That's you out in the community.
And sometimes I do 2
There's
events in one day.
10,024 of those, but
It's a real
Sometimes I'll
thing.
do a couple of events in a day. Like there may be something today, and then tonight there's another opportunity. Wherever there's an opportunity, I'm there.
My goodness. Your energy level, Lori. Holy cow.
all right, Melik, it's your turn.
Nope.
Okay, not same question, different question. But, we've talked a lot about presence and kind of being there. And I think a lot of times when we talk about gun violence, we automatically, our brains go to the physical injury, right? And preventing the physical injury or treating the physical injury. But there's a huge psychological domino effect, right? Pre-event, post-event, that goes on. And so talk about that. Talk about some of the things that you see that are psychological impact of violence.
Absolutely. So that's such a big question.
That is a big question.
Thank
What is
goodness
a
you
big
get to talk
question?
now. I get to take a breath.
Right.
Drink some Diet Dr. Pepper.
Yeah.
So it's a big question because, like I mentioned earlier, a lot of our youth who are coming into our hospitals to be treated for an injury related to violence, whether that's on I don't want to say milder, but on the one end of the spectrum, which is those assaults we talked about, to the more extreme, which is a gunshot wound. And I say that on the spectrum because, again, I've seen kids come into the ED with an assault that resulted in like a traumatic brain injury. And I've seen kids who come into the ED with a gunshot wound and it's a through and through to the hand, no mobility impact. So again, 2 types of injuries with way different needs set, right? And I think a lot of times we think about assault and we think, they'll be okay. They'll shake it off. A lot of parents are like, it'll be okay. And so again, those kids are coming from communities, not all, but again, a lot of our kids have been exposed to violence already in their communities. They've either been at schools where fights have broken out. They've watched classmates be in violent situations. They've experienced loss of classmates to gun violence. When we even think about our St. Louis community, we had a school shooting here 2 years ago almost. That psychological impact of all that our youth are being asked to absorb, process, and then be resilient, right? Because we say, our youth are so resilient. But more specifically, when we talk about violence, again, a lot of my kids are coming in with pre-existing trauma. Also, a part of that is generational trauma. We have parents who have also been victims of gun violence. I've seen that occur quite a bit in the time that we've been doing this work. I've had a mom who'll come and be like, well, I got shot. And, some of that creates this normalness of like, oh, it's okay to be shot. Or it's just part of what happens and we just got to get you through it and pat you up and put you back out in the community and hopefully you'll shake it off, right? But really what we see is for my young boys, we see that suicidal ideation that Lori was talking about. It comes up, especially if they have a mobility injury. I've had a youth who didn't know if he was going to get to walk again. We've had youth who did not have the capacity to walk because of a spinal cord injury. So life changing. And then also extending from the youth themselves to their supports. Right? Even for the less severe injuries, I have moms who are like, how am I going to keep a 15-year-old boy in the house? And mom's anxiety is through the roof, right? I don't want you to go out. I don't want you to be outside. I don't want you hanging out with your friends. I don't even want you talking on the phone to your friends. And you're like, well, good luck. Because any teenager, that's a task. So what we strive to do with our programming is, one, help educate on the signs and symptoms, that some things are normal as just part of the physical recovery process. Like sleeping, if you have pain, you're probably not going to be sleeping your best. But if we get to a certain time period where this is going on for weeks and weeks, now we need to look at different ways. A lot of our youth, as Lori mentioned, are already coming in with additional mental health diagnoses, right? So you got comorbid situations occurring. And so again, we leverage, one, what resources are they already connected to? We're really screening for those shock, stress, potential trauma symptoms that are coming up, and then work for strategies to mitigate them from becoming more progressive or severe. We see a lot of kids who become hypervigilant. They're very anxious. They're very paranoid, especially returning to environments where they've been harmed. So for my kids who have been injured at school, going back to school is like, You're like, okay, but you're a freshman in high school. You're going back to school. And they're like, no. So that's why our ability to go into the community to provide that support, to identify more supportive adults, to set up planning for them to make re-entry into these spaces safe and feel that they have amplified support is so important. But really, we just see that across the board of trying to reestablish and repair relationships that need to be in place for that youth to feel supported, and to also even with their healthcare providers, right? It's like, well, making sure we here at Cardinal Glennon do an amazing job because our trauma team is small. So like our trauma nurse practitioner sees them, they have a relationship there. Our trauma surgeons become very invested because we work collaboratively, and that enhances their sense of one, support, confidence that their healthcare providers are invested. We have nurses or doctors that are like, how's that kid, right? And so we can continue to follow them and make sure that they have that access. But it's impactful. But again, a lot of it is that some of my kids are desensitized in a way because they're like, it's just what happens. And so like part of that is shifting that idea and shifting their narrative to say, this isn't just what happens. And this doesn't have to be the thing that defines you. You have the opportunity to have a future, and let's walk through what has happened, help you heal so that you can go pursue the things that you dreamed about doing.
And it's funny that he brings that and talks about that desensitization. So just to share an example with you, and it's not related to gun violence, but kind of it is. So we did a docudrama actually at the CVPA school where that shooting had occurred, but years before that. And so a docudrama is like right around Operation Prom, where they have a car that's, been involved in like a drunk, alcohol's involved, drugs, distracted. They had the school student council were the victims and they were the actors, if you will. Anyway, they bring in EMS, fire, helicopters. They even brought in a hearse as well as with the medical examiner. They put the child into a body bag. And this is to prevent kids on prom drinking and driving and distracted, etc. So when I was sitting there observing these children, in came all of the ambulances. They were all on the football field in the bleachers. And so the ambulance and all the fire equipment and everything were coming in this way for our, kind of like from the west side. And all these kids were, hey, good, yeah. And they're just joking and playing and not really paying attention, right? But then our helicopter landed on their football field. And you could hear a needle drop in those bleachers because most of these children are desensitized by all the sirens because that's their normal life, if you will. But in the city, you don't see air medical transport.
No, you don't.
Now, if you go out to Washington County or somewhere rural, you probably would not get the same response. because they're used to seeing the helicopter because of their, response time. So absolutely. And you know what, Melik? It's not okay. This life is not okay for these babies. And these babies need to know this is not a normal, nor is it an okay life for you.
I mean, it's funny that you say that. And I know we're probably off y'all's question, but it's funny you say that because part of what allowed Lori and I to start working so closely together is because I had a new mom. Because again, the parent of my youth that was involved was a new mom, had a small baby, and she was concerned because every night there would be gunfire. Bullets do not necessarily have trajectories once they are released into the air, right? And she was very worried because some of her neighbors had their windows shot out, and so she began to sleep with the baby on the floor. And then as her anxiety rose and she began to become more paranoid, she would say some nights she would put the baby sleep with the baby in the bathtub because she felt that was the safest space. And I remember reaching out to Lori and I was like, Lori, I got this case. Let me tell you what's going on, right? And Lori was like, whoa. Baby on the floor, baby in the bathtub. I was like, yeah. And so Lori was like, well, first thing you gotta get safe sleep. You gotta go get safe sleep trained. I was like, I gotta get safe sleep. What? This is not how this was supposed to go.
The crossover begins.
Train the trainer.
Correct. No, she was like, and then this is what you gotta do. But it was through that connection of just like, and then Lori continued to make sure that I had the support that I needed to support that mom, which in turn supported my patient, who we were able to work on housing, all these other additional things that really set them up to be successful. But it was that intersection because Lori's like, she slept with the baby where? She's like, come down to my office. And then in turn, it just began to grow because we started to see it come up, and it just speaks to the prevalence and the increase and the fear. So to your other question about like the psychology of it, a lot of people are just living with anxiety and fear from day to day. But in that space, it's like, what can I do?
They're doing what they know.
They're doing what they know.
And what they can.
And what they can. And part of when I love the opportunity to even just have conversations like this, because a lot of my work is too shifting bias. A lot of people have all of this bias about who gets shot, why do they get shot. But we've had, I can countless times we've had a kid who came in with a gunshot wound who was literally walking the trash to the garbage dumpster in the alley. Not doing anything more than following his mother's rules, which was get off the game, go take this trash out. I'm not going to ask you again. You're stepping out into your city alleyway to put the trash in the dumpster and you're caught between the crossfire, literally. And so again, it's breaking the bias. Are you not supposed to take the trash out?
Right.
Are you supposed to get a bulletproof vest or do it very fast and run and sprint and hop hurdles to put the trash in the dumpster? So again, part of it is shifting that, because I think when we watch the news and we consume the media that tells us that we have an issue with gun violence here in St. Louis, we know, watch the news tonight, tomorrow, our weekends, you're going to see it, but it's not telling the full story, that these are people who are living in the communities that they are living in, and they want to be productive in their communities. They want to have a safe community. And so in some ways that just becomes a part of what their world is like. Whether that's Lori's point, it's not normal. It's not normal to have that anxiety as a mom.
Nor is it okay.
No,
Nor
it's
is
not
it okay. Yeah.
That's my thing.
So I know, Melik, you touched upon it a little bit earlier, but the LOVE program, can you kind of give us a step-by-step how it works? Like whenever you have when you have a patient or a client, or I'm sorry, I don't know the exact terminology, but like how it begins, like at point of injury, and then going through what all the steps are in the program.
Absolutely. So for us here at Cardinal Glennon or any of the other partner hospitals, our ground zero, as I like to call it, starts in the emergency department. So we are either notified when like our trauma majors are called, or we know that there's a patient coming in. If we can, the first option for us always is to respond at bedside, right? The goal there really is to interface with our amazing ED department social work team. They are phenomenal. And so we work with them collaboratively to make sure that, one, we get a pulse on who the patient is. We kind of try to interface with the mom. Some of our patients who are more severely injured are rushed to surgery. So again, we're just trying to establish some connection and let them know that we're here, what we do, why we function. Usually, if it's one of those ones where they might leave the ED because their injury is a little less severe and they're going home, like some of those assaults, we would then follow up with them once they go home. And usually the very next step is that we set up an in-home visit. At that point, we're then able to assess for baseline things. I tell people if I could put it on a timeline, the first 0 to 3 months is why we call our position clinical case management, because that first 3 months is really heavy on stabilization, right? Addressing those social determinants of health. So we're looking at, you ask somebody to go home from the emergency department and clean their wound with soap and water. Well, if they don't have running water or there's some utility assistance that is needed, then what is to many of us who have some level of privilege, that's a very easy thing to do. But for somebody else, that could become a barrier. So we look at that. We make sure that we have a full pulse on what the need set is. And then usually it takes about that kind of 90 days for them to get back to what I say is like homeostasis, right? Or stabilization. And then from there for like 3 to 6 months is really when we start those therapeutic interventions. We've kind of got a pulse on who they're connected to, what supports we need to connect them with. And we've got that plan in place. A lot of the work that we do is a heavy approach to a therapeutic program in the sense that everything we do is applied therapy. But I tell people we do therapy in a community space. So we have to be very creative. Mm-hmm. There are times when I've been with a kid or a family and I'm holding a baby and we're talking through some things, or I've got the gerbil, the family pet, that is rolling around in a ball. So not like my old days of therapy where I had a nice little office like this and I could, right? So we have to pivot. We have to be flexible. But what I like about that too is that for a lot of our youth, this is sometimes their first introduction to mental health services and support. And so I'm a big champion for saying, like, if this is what they get first, we want to make sure it's something that they feel it allows them to be their authentic self, allows them to have a real experience of therapeutic support and therapy, so that when they continue on in future times of life, they will say that was a positive experience and want to then continue to have that layer of mental health support throughout their lifetime. So from there, usually for our younger kiddos, when we have our 8-year-olds or 9-year-olds, because that's as early as we start is at 8, that might be play therapy. That might be all kinds of fun things. We do sand tray. We have mobile therapy kits that we can take out with us to then again have some tools for us when we're when we're not in an office space because we're doing community-based work. And then usually when we get to that 9 to 12 month mark, a lot of that is helping getting them equipped to transition, right? So for our teenagers, that might mean they're ready to get a job. We work through some of that job and performance anxiety. We work through amplifying their emotion vocabulary. That's something I work on pretty much with every patient because, again, a lot of times I tell people, we don't teach kids an emotion vocabulary. They learn it based on observation, but that then doesn't equip them to have understanding of what they're feeling and then express that to others. A lot of times I ask my young boys, tell me 5 emotion words. And they're like, mad, sad, mad. Like you already said, mad, right? And then I challenge them. I say, if I give you 5 random words, could you make a complete sentence and get everything that you needed? Whether it was something to eat, whether it was to go to the restroom. If I gave you 5 random words and they're like, I couldn't do it. But in the same way, if we don't have emotion language, it's going to be really hard for you to communicate to somebody else and be able to express what you need and where you are and get the help and resources. And so that's a lot of what we do there too.
I think everybody needs a Melik session.
For sure.
I agree.
So, I mean, I'm not lying.
I have them on retainer.
I know. I'm signing up.
She feeds me good Italian food, so I'm always down for a check-in. Yeah.
Italian food for therapy.
Yeah, hey, I'm all about a good barter session.
So you mentioned that you have a lot of teenagers. You mentioned some 8-year-olds. Who's eligible? Like, I'm thinking this program, it covers a large span of individuals, right? Because we're talking about the adult trauma centers, the child trauma centers. So for us, like, what's the age range, I guess, of eligibility and geographical area that you serve? So
for folks that would come here to Cardinal Glennon as one of our pediatric partners, we serve up to 30, but again, we would interface with folks who are young as 8, and then probably, I guess I would say, to like 20? Sometimes we get occasional 20-year-old here at Glennon.
Sometimes we get 30-year-olds, if depending on which highway they drive.
True, right. But usually we're starting on
stay.
that. Well, yeah, they go.
They go next door.
They go next door. Yeah. But usually a lot of our folks at Glennon that we interface with, I would say we might have a 20-year-old maybe, but really it's that 8 to 18 range here at Glennon. But the program services folks all the way up to 30. The real criteria is, of course, they have to have one of those qualifying injuries. So we cover 3 of the 6 categories. So that's the assaults, the stab wounds, and the gunshot wounds. We service St. Louis City, St. Louis County, and most recently, in about the last 2 years, we've expanded to include Illinois, because what we learned was that we were getting a lot of people coming from Illinois, one, because of geographics, we're the closest level ones once you come across the bridge. So we're seeing high numbers, but yet we hadn't quite expanded our program enough to be able to support that. And then we also recognized Glennon was on the front line, like, hey, we need to really see what we can do to service these patients, because the resources are not as strong once they go back across the bridge to home. And so they were really intentional about figuring out how to expand service region and area. And we did that. And so we were able to touch folks from Illinois as well.
So tell me about that. You were able to expand. So what was needed to expand? Like, what does that mean?
So what that means is when this program launched originally in 2018, we started as a research pilot because we needed to figure out if this type of intermittent intervention was actually going to make a reduction in reducing retaliation, injury, re-injury, and ultimately death, right? So the goal was to save lives. And what we found, we started small, we only did city and county, is that we had this big population of patients that we couldn't serve. And so what that meant is that we were able to mobilize support through the Glennon Foundation to help expand what we could do. Once we finished our piloted research program, that also lessened like research restriction, and that also helped broaden it. So it took fiscal and institutional support, as well as pivoting from that research restrictions that kept us from doing that.
Do people, this sounds like a weird question, but I'm just curious. Do people say no? Like, so the injury happens, they're here. Mm-hmm. You try to be here at the point of entry, or at this pivotal teaching moment kind of thing. Do people say no, thank you? Or people like, yeah. I don't want your help. I don't want your support. I don't want you coming into my home. Or do you find that most people are very accepting of your service and your support?
So, well, I don't have these rock star numbers like my counterpart over here. So our program, the average caseload for our clinical case manager is between, on average, we say 10 to 12. On the high end would be 15, because again, we talk about how we support more than just that youth, right? Because most of our patients come with parents, right? So we're supporting the family. We provide support to those siblings because, again, some of them witnessed the injury. So we're kind of supporting that whole unit. Because we know that just because one person is impacted by the physical injury, there's a whole sphere of folks around them that are impacted by the actual trauma, right? So we keep our caseloads relatively small, but since we launched in 2018, we've served about 60 folks, which seems low. But again, if you keep that in relationship to our caseload, that actually is about 10 to 12 per year that we've enrolled. But as far as like people we've interfaced with, we've outreached and offered services to about over 300 people. Of the 60 we enrolled, we have about 70% of them who actually finished the program. So, and what we mean by finished means that they've received services anywhere up to at least 6 months of programmatic services. And those services are, again, those weekly home visits, additional school-based support, and all of that. And then across the Life Outside of Violence program, when we looked at our data from 2018 all the way up to 2022, we found that we had a 60% recidivism rate, which means that our patients were less likely to get re-injured by being connected to our programmatic supports. And then when they were re-injured, they came back with injuries that were less severe than the initial injury. So that may be like someone who had a gunshot wound that then became downgraded to maybe the next time we saw them it was an assault. And so we know that based on that research, based on the work, that the program was effective, that it was working, which is what also helped the hospitals, particularly Glennon was at the front of being like, hey, we want to keep this program going. We want to continue to push to work in this capacity because we saw the positive impact. Now, to the second part of your question, do people of the 300 folks that I talked about, we enrolled 60, right? Some of the 60 is based on capacity for what we could do with just one person, right? Lori's got a few people in this role, which just
only 2.5.
Okay. 1.5 more than me, right? So it's only one person managing this. So again, that speaks to scope and capacity. But a lot of what happened with some of those 300 is not so much. You might get an occasional family who says no or decline services because they may already just be connected to so many other things. And they're like, you know what? We kind of got a couple of different pieces in play. That's okay. The other pieces is that it's good working contact. And that's what we found is that because, again, these same social determinants of health, if a family is struggling with assistance, with utility support, a lot of times they don't have good working phone numbers or they're highly transient, right? So I knew where you were today, but I don't tomorrow. And so we know that that's a good percentage too that impedes our ability to engage them and then offer enrollment and supportive services.
Well, I think it's funny that you said I don't have numbers like Lori. We don't want you to have incidents like Lori, right?
No.
We don't want thousands.
Like
yeah.
that.
Well, I know.
You
But
know,
think about it. Lori and her team are playing games, and we have these little short hourly interventions and interactions. Whereas Melik, his clients, I mean, yeah, they might only meet for an hour a week, but it's much more
intimate.
It's a much more intimate relationship, and
Well, and it's a long process.
absolutely
Too.
that part.
How long does it take to tell somebody while you're giving them some giveaways and candy? Hey, and by the way, but
Don't dilute what you do now.
I mean,
ma'am.
No.
Yeah.
Because if you hear her spiel to grandparents, now again, I think she got a soft spot for these grandparents about gun locks. It's insane. They're like, well, yeah. And we're like, the kids always know where the gun is. And they're like, no. And you're like, yeah, they do. And they'll tell us. Like when they get in the plane, like, oh yeah, I know my grandpa gun's in the back of the closet. You're just like, he's like, I didn't know he knew. They always know.
Okay, we're going to get soft here for a minute. Okay, Melik, can you talk about a case that was the most impactful for you?
That's a tough one. Because in the 6 years that I've done this work, I've had a lot of amazing youth that I've been privileged to work with. I don't take the ability to walk beside somebody on that journey lightly. I know that it's truly a gift to walk with them at some of their most difficult times. And there's quite a few. I to get to do Glennon 101 is one of my favorite things to do, and I tell lots of stories. But one kiddo who really sticks out to me, who was featured in a Glennon Foundation magazine. His story is up on our Life Outside of Violence website, which we can share with folks if they want to see the rest of it. But it was a young man named Jeremiah. He was 15 years old. At the time, he sustained multiple gunshot wounds. And what makes his story so unique is that his uncle had volunteered to take him and his brother for the day. It was Mother's Day. So his mom was like, oh, we're getting the day off. She was like, okay, I'll send the boys with you. And so he was with his uncle, doing what teenagers do. He was sitting very much so on a couch like this in front of a glass sliding door on his phone, social media, just downtime, right? When out of nowhere, bullets flew through this glass screen door. He sustained several gunshot wounds to the body. And he didn't even realize it. And you can hear that later if anybody chooses to watch this video. He didn't even realize he was shot. And so his uncle kind of crawled in and drug him out of the living room to safety. And so I remember meeting his mom and them at the time at the emergency department, and just her saying, I can't believe of all things that I thought would happen to me or for me today on Mother's Day, that I'll get a phone call that my son's been shot. And she just talks about racing to the hospital, beating the ambulance, just the power of like a mother, her love, and just her just passion. I'm going to save my son. And so met this extraordinary mom. He had a brother. If you see them together, you would think they look identical. I was like, wait, who? Okay, it's you. Phenomenal thing about Jeremiah. He has the best hair ever. It's like the best hair. And I just remember him being kind of resistant, kind of shut down. He was like, Mom was very much so an advocate for mental health. She's like, nope, he's getting in this program. I was like, well, definitely need you to consent, but we kind of need him to want to, because it is still a voluntary program. And he's like, yeah, I'll be in it. I was like, whoa, this one's going to be rough. I don't know if he's going to talk. I don't know how this is going to go. And little by little, I would see Jeremiah sometimes even twice a week because I'd get a call from his mom and be like, he's struggling this week. When Jeremiah, before he got shot, he was a straight A student. He's very much so into STEM, robotics, engineering. And after his injury, he was like, I don't care about going to school. My life is over. I was not doing anything. Why did this happen to me? Why should I care? Right? What's my why? What does it matter? You know, if I could just be doing nothing and this happened to me, then what's the point in even trying to do something? And so Jeremiah stayed in the program for the full 12 months. Over that time, we worked on goals. We worked on him wanting to get a driver's license. I was like, oh, Lord, I got to get off the road. If you get a driver's license, it's time for me to retire, I think. And so he was able to go back to school. He got into a advanced program. He took automotive programming. And so fast forward, Jeremiah is now, because it's been quite some time, he's graduated. He's in the process of going through his military clearance. What's unique too is that his mother is a big champion for telling their story. Because she believes that young boys should have access to mental health care, that families need this type of intimate intervention at time of such a critical moment for them all. What we saw for them as a family is that their communication increased. She was like, he talks to me now, probably more than I want him to, about things that I probably don't want to hear about. She's like, he talks a lot now. I'm like, yep. And so their relationship enhanced because he learned communication skills. He learned how to identify those feelings. Jeremiah is now no longer a part of the program. It has not been for a while. But when I tell you Jeremiah is one of my forever kids, he's one of my forever kids. He will text me and be like, how are you doing? Just checking on you. Because it really just speaks to, again, when we first started, I was like, this one's going to be rough. But to hear him now, he's like, I'm excited. You know, this is where I'm at. The military process is taking forever. And what's interesting too is that for him to be where he's at for potentially going into the military is he didn't think he would, because he thought his injury, having sustained the gunshot wound, would keep him from having eligibility to go to the military, because that's one of those things that they look at case by case, because he suffered such a significant injury. And so that was part of the frustration. Like, I wanted to go into the military. I wanted to do all this special tech stuff on planes and boats and whatever, I don't know, all the things. But yeah, another cool thing too is, like, I talked to his mom. She checks in with me regularly since he's been a part of the program, and she's always a big advocate for how can she help, what can she do in coordination with the hospital to continue to champion for the program, because she truly believes in its impact. And mom is now also she's always been an entrepreneur, right? She's always been an entrepreneur, but now she owns 2 small stores in Ferguson. She's constantly preaching to family that they should access programs, support, champion for mental health, which I just think, again, if we talk about disrupting the cycle of violence and changing the narrative and shifting the trajectory, it starts with that small seed. And now mom, because of her positive experience and her positive impact, have totally shifted how she engages with her community, what she wants to do in that community, as well as for Jeremiah too.
What a great story. You know, I find it interesting that you mentioned that she's such an advocate now. And a big piece of that is for the mental health component. Is that a stigma? Does she see that a lot amongst where she lives, that it's a stigma to desire or to seek mental health?
I think that's a big part of, like, mental wellness within the community of color, particularly the African American community, particularly mental health and African American men. And I think that's what made Cardinal Glennon's intentionality of having a Black male therapist in this role so important, because it allowed them to see, like, this is what mental health looks like. This is why it's important. It allowed difficult conversations to happen. And so I think that it has been heavily stigmatized. And I think now we're shifting from looking at it as, like, just the singular of treating the body and recognizing that trauma lives in the body, from the physical injury, for our patients who still carry their bullets, walking around every day with something inside your body that was meant to harm you or kill you, and you still carry that each day. And so looking at how are we shifting the narrative around accessing mental health, what types of mental health services look like, from environments that we don't necessarily see them from, right? We think of the hospital, we think of emergency department, we think of physical. And so I think that integration with our programming to say that your body and your mind and your mental health is one. And we want to treat you in a whole way, in a holistic way, and in a comprehensive way, because all of it is important.
Amen.
Yeah.
How rare is a you? I'm so serious right now. Like,
it's I mean, I think we're seeing it change. I think access to just the well, let me say it this way. I think we're seeing it change because I think we're recognizing that more communities of color, not just African American, but just communities of color in general, are seeking more mental health services. We're seeing more bilingual therapists coming so that they can support folks who are non-English speaking. And so we're seeing historical entities being very creative and innovative about how they're making these services accessible. And so because we had to think about who needed the services, right? Because sometimes with organizations that have been around forever, we have a way in which we've done things. That's just what we've always done. And so now we see a lot of creativity, a lot of innovation, and a lot more embracing of diversity and saying we want to serve all of our patients. We want to serve all of our community. And how can we do that?
right.
But it's coming. It's growing, I should say. We're growing.
Well, I do think that, and you can correct me if I'm wrong, but I do think because our youth and because people, whether they're of color or whether they're not, they really rely on social media. And I think that our heroes, if you will, people that they've looked up to, for whatever reason to be their hero, are now admitting that, hey, I'm struggling and it's okay. This is okay. This is normal. You need to get help. And so I think us at this level, they don't want to listen to us, but boy, maybe with what we're saying, in conjunction with who one of their superheroes are saying, maybe there is some validity to that. Wouldn't you think?
Sure. Absolutely. I think from a larger platform, we've just grown in our understanding. We have organizations, and Cardinal Glennon is big about mental health days, like even just being intentional, saying like we recognize that like as a community, when things are happening, like whether it's those watching the news, something happens, our school shooting, right? Again, we had to think about collective and communal mental health, right? Because I'm only as well as you are. So if I am not well or you are not well, then our community is not well. And so Lori mentioned earlier, but in this work, particularly prevention and intervention, it's about a village mindset, right? So we know that to make these things happen, prevention, to get gun locks out, to do an intimate intervention like LOV, it takes a village. I needed Lori in my village to make sure that my families got what they needed. We need our community partners to make sure that our families get what they need. And we need to make sure that there's a seat at the table for everybody. And we're making space for those voices to be heard and amplified and lifted up, so that the message can be carried.
And we're acting on what the voices are saying.
Correct. To the action pieces.
Listening to, we're not letting them speak and voice what they want. We actually are acting on what they feel they need and what they want.
So, Miss Lori, I am certain that you have a story that's impactful for you. It's your turn.
I guess the one that sticks out the most in my mind because, well, actually all of my families are my families. Okay. And they're all important and they're all unique, just like your children are all unique and you don't have a favorite, but I do have a favorite. And this was young. Well, my sister was my mother's favorite, but anyway, so this one young lady, so during COVID, we, when the world shut down, babies were still coming and, families needed resources and they didn't have accessibility to them. So one of the things that we chose to do was to offer and to work with one of our community partners to offer a 6-week, one session a day, if you will, or one session a week topic of education. And for 5 weeks. And on week number 6, we were doing, and we had partnered with one of our managed care groups. We partnered and we had a drive-through baby shower. Well, our community partner over at the ARJ Community Center who wanted to host this, she was insistent that the drive-through baby shower be on Mother's Day, the Friday before Mother's Day. Perfect. So week number 1, and we had different topics each of the 5 weeks. Week number 1, when we introduced the program, et cetera, I asked for any of the moms that were on the class, if they had a picture, if they had other children, to send me or text me a picture of their children. If they were a new mom or an expectant mom with no other children, if they wanted to take a picture of their belly, I didn't care. But I wanted something to give them on Mother's Day to really show them and empower them that they are a good mom. Okay. So this is how this young lady got my cell phone number and she sent me a picture of her 2 children. And I remembered sitting in my home, my son, when he was in preschool, made this little terracotta planter, and it had a construction flower with his school picture in it. My son is 32 years old, and yes, I still have it. And I said, that's what I'll do. So I made one of these for each of these families. And then I went and I bought each of the moms a tube of Hello Beautiful lotion, and I put it in a bag. So I let the children give their mom a Mother's Day gift when they came through the drive-thru. So let's move forward a little bit. All of a sudden, I get a text message one day, and it's this African-American gravid abdomen, and says, the baby's growing. I'm like, who is this? Right? So this relationship had started. So we had baby Zahara, and at 4:30 in the morning, okay, or 3:30, whenever Miss Zahara was born, I get a text message of a newborn baby from the hospital. And it made me think, why are you reaching out to me to show your baby's picture and not to your own family? Oh, because you didn't have any support. So she never wants to talk. She just wants to text. And actually, she would send me pictures as Zahara was growing. And there's one favorite picture I have. Zahara's in this little bright yellow sunshine colored outfit. And she said, just to brighten your day. And it did. And so then she was struggling with some mental health, like postpartum depression, and she didn't feel worthy and she wasn't a good mom, blah, 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 moving forward. So I tried to make sure she was not wanting to harm herself. I sent her resources like to the mom's line. Why don't you call? This is normal. About 2 weeks later, she texts me, and she texts me her apartment, and she thanks me because I was there for her. And she said, because of what I told her, she started a support group like with other pregnant new moms, and they talk online, etc. And look, I even have the energy to clean my apartment. And I was like, wow, this is great. Again, being present, answer, just texting. Am I bothering you? I'm like, no, it's Friday night. I'm sitting on my couch watching television or whatever. No, you're not a bother. So then she also told me that she was trying to teach her baby's dad how to do math. But over the years, this has developed. Zahara was 2. I guess it was last summer. I was out at a back to school event in a gymnasium, and I hear, Miss Lori. And she came running across the gymnasium, and she grabbed me and she hugged me and she said, you were like a mom to me. You saved my life. This is your granny, girls. I'm like, I'm not sending any of you to college, but what else do you need? But Zahara held on to me for dear life. That is my story. That is my why. I'll always be there for her. And I check out to her. That's all I can say. I can't say anything else.
I'm just done.
That's
It's crazy how, it's not crazy, but how alone people feel.
Oh, yeah.
We've talked about the power of presence a lot. And,
I had another mom who she had twins. And it really does make you want to think sometimes. And I was over, because I would do these classes, and I was doing it at St. Mary's. And she had her twins. And when I was getting off the elevator to go get ready to teach the class, she was coming out of the birthing unit. And she's like, oh, Miss Lori, hi. And I was like, oh, hi, how are you? Blah, blah, blah. And she goes, I had my twins. Do you want to meet them? And I said, sure, I do. I was running late, of course, to get ready, but I was not going to give up that opportunity. So I went in the room, and she's got these beautiful little girls there. And she looked at me and she said, did I do good? And I thought, why are you seeking validation from me, a woman that you've met for 2 hours? And it really made me think they all are going to have my all, because I don't know who has or who doesn't have somebody to validate their beautiful, their beautiful experience or their babies. So
that's your return on investment.
Exactly. That is my return on investment and my why.
Those are strong stories. I want to, you talked about some of your impactful stories. I want to look to the future. So This is a question for both of you. If you had a magic wand and you could use it, how would you expand what you're doing now, and what is needed that you don't currently have?
I mean, I think the challenging part, of course we could say the obvious things, right? Like we love to have another staff person. We would love
Sure.
to have more resources. But I think there's two pieces for me that stand out, particularly when I'm looking just at what we do on a pediatric level, is aftercare. Because I think to Lori's point is, we have this 12-month window for patients, right? And then what? Because now you've stepped up, you've been a representation, you've kind of gotten to mentorship, you've been invested in this family's life, you're really living the mission of showing up and the power of being present and being engaged. And then what? Right? So I think for us, aftercare is a big part of that, looking at ways that we can expand programming there. We've done expansion in our program by adding Illinois and some things like that. But I think really just developing more support beyond what they get in that first year, and being flexible in that way. And then I think the other piece that always stands out too is a big part of what we do in our program is we do incentives, right? And we offer our kiddos small things, right? Because for a lot of them, no one celebrated their wins, right? Or they don't have them, they need to gather the motivation to then keep it going for themselves, right? So it's like, why do you care if I go back to school? Why does it matter if I get a B? Why does it matter if I finish high school, or if I don't get into a fight today, or I do these things, these positive behavioral changes, if it's not going to count for anything, right? And so what we've been able to do through the foundation support is making these incentives there so that they have something like, man, you brought me a $10 Subway gift card, and you're like, yeah, and they're like, you remembered it was my birthday. Like, you acknowledged something that was big for me. You celebrated with me, and again, a part of that walk. So I think that's the other piece of it too, is just being able to build out more of those programmatic pieces of being able to engage in that way, as far as like continue to create moments for them in just being able to celebrate. But I think for me, the biggest piece is aftercare. Like if I had a magic wand, I could add like an extra 6 months of programmatic support, right? Which then of course correlates to some staff.
Yeah.
I'm putting her out. You coughing on my dreams?
You
See
can
what I
cut
got?
that.
She coughed on my dreams. Don't cut it. I want people to know how she really feels.
Redo his dream part.
Nope. It's over. I want aftercare, and I want it now. It's like J.G. Wentworth. It's my money, and I want it now. But yeah, what do you dream about? What's your magic wand moment, Lori?
So we obviously are not going to eliminate unintentional injuries no matter what. But I do think that my ideal dream would be to expand our program, i.e. more staff, but not necessarily to put it into our hospital focus, but one of these, let's revitalize a home, a house within our community to have a Charlie's Kids House like they have in Kansas City. And so every room that you go in, not only are all of the educational pieces and components there, but showing how to, kind of like a museum, but not really, showing how to, you need to have outlet covers, and this is how you secure your television. In each room of the house, make it like their home. And we have so many condemned or dilapidated buildings that they just want to knock down. Just getting an investment into having a Charlie's House is what it's called, and it's in Kansas City. It is wonderful.
Can we call it Lori's house?
No.
Okay.
Well, can I be
Okay,
usher?
never mind.
You call
Can
it
I be like
Melik's
the
house.
no? Can I be the usher and get a little blazer and like guide people through?
And then
Be the
also
door.
have the resources there so that we can do our car seat checks there, or we can have the resources there instead of coming into an education room, not really getting that engagement. We're really showing, I don't know how you're going to hang these straps up at your house because I haven't seen your house, but being able to actually demonstrate the correct use and having that more intimate conversation on, individualizing the care or the resources and education to them as well, and showing them how to do that.
Sure.
But again, that takes staff, and that takes a building.
And other things.
And other things.
You mean so you can teach me not to throw away those things that come with my furniture that I built for my kid.
Exactly.
So that it's supposed to keep the thing from falling on the kid. Huh. Well, I learned something.
Right. See what I mean? So, I mean, it's really, especially since we have this abundance of these old houses and they want to revitalize, we don't want it way out in, again, bringing
it to where
the
people
resources
need it.
where they need it.
Right.
So let's start with one and, like kind of centrally located around Cardinal Glennon. I'm sure we could find a house somewhere, but then moving it out a little bit further, because when this becomes very
when
popular,
it takes off,
we can have satellite offices.
There you go.
So, but that's to integrate that, I think it would be great. I think we'd get a lot of better adherence and understanding.
Well, I know both of your programs have been around for a little bit. I know our donors have been instrumental to the support of both of your programs in different ways. We've had grants and donor funds pay for gun locks and car seats and safe sleep environments, some salary support at different levels, different intervals. How can the community continue to help? If someone out there is listening and hears about your programs, hopefully they do. Hopefully somebody's listening to this, right? And wants to help. How can they do that?
Well, I mean, they can always reach out to the foundation
Yes.
and offer, whatever type of support or assistance. But I mean, financially, we can always use that. If you're not in a position to be able to assist our program financially, helping us share the word,
Right.
and spread the word.
Right.
Allowing us to come into your community and maybe host an event and let us share what, resources and education and knowledge we have within your own community, like that, kind of like that networking and becoming part of our village. Let's put it that way. Good answer, right?
Great answer.
I
I think not only other, but one additional thing I can add to what Lori is saying too is a lot of, like I mentioned earlier, my mission with my work is to getting people to leverage the fact that it is village work, right? Some people feel like we often feel helpless when we watch the news, when we hear about the violence in our community, when we hear about what's going on in the nation from a standpoint of communal violence. A lot of times we feel like, well, I'm not a doctor. I'm not a social worker. I don't work in a school. I live in the county. I don't live in the city, right? Or they want to help, but they don't know how. And so I always want to encourage people to think creatively about how to leverage what resources you do have, right? So to Lori's point, offering for us to come in and train your staff, to talk about these issues, to create more conversation. And if that leads to reduction of bias around gun violence, we're all for it. If it leads to increased prevention, we're all for it. If you might be somebody who has an opportunity to extend an internship to a youth, right? Again, a lot of our youth work in fast food. That doesn't always feel safe because it's open access. A lot of our youth don't know that there's so many great things in their community because, again, if they don't see it, know it, and not exposed to it, it doesn't happen. So really just looking at ways in which you can be creative about what you do or what you're an expert at, and is there a way for us to have some intersectionality there? So again, bridge those gaps, enhance and embrace the idea of greater community, and then really live our motto of it takes a village. And so that would be something that if anybody's listening, hopefully somebody's listening, that would be something I would really want to resonate with them, is that while you don't necessarily do what I do, what you do is important, and maybe there's a way for us to collaborate.
And actually, even with the advocacy part, in their own community, speaking to their lawmakers, of people that can do policy change, because we know that this is a system problem, what we're encountering on all things. And we do know, just like, for example, with car seats and child passenger safety and motor vehicle crashes, you can see over the time frame how pediatric fatalities have decreased because of car seat laws. Well, they're not going to get put to the table until we, the community, speak to our lawmakers to make it seem important. It's something that needs to be addressed. So we always agree that it takes more than one voice. It takes all of our voices to really try to make a difference.
And I always just say
and that doesn't cost anything, does it?
It doesn't.
No.
And I just say too, there's always a place and there's room at the table, right?
Always.
And particularly when we talk about gun violence work, it's not just a policing problem. It's not just a hospital problem. It's not just a school problem. It's not the church's problem. It's all of our problem, which is what makes what we're doing so amazing, because the hospitals recognize they didn't just want to patch people up and put them back in the community. They wanted to become a part of the community and actually be a member of that community, not just an occupant of some streets. So.
Well, there's a lot of work to be done still, like you said, from many angles, and it takes a village, but you are both evidence of what can be, right? And it takes more than just the 2 or 2.5 or 3 of you to create change. But you are absolutely evidence of the healing power of presence. And you two are just, sorry, I do this every time. You two are just trailblazers. And I can't imagine all of the families that you've crossed in your years of doing this work. I can't imagine their lives without you having been part of it. I think of that little Zahara, just that, something so small, that wasn't a massive effort, but that took intentionality and you did that. So I can't imagine our families without the two of you and what you've laid the groundwork for other people to join up with you and join hands with you. You are the Glennon Factor. That's why we had you on. So thanks for taking time with us.
Thanks for having us.
Yeah.
Thanks for everything you do in the community. We hope you enjoyed this episode of The Glennon Factor. Make sure you follow The Glennon Factor and leave us a review wherever you get your podcasts. Visit glennon.org if you would like to learn more about how you can support Cardinal Glennon kids. And while you're there, feel free to share any feedback or episode suggestions on our podcast page. The Glennon Factor is recorded and produced by SSM Health Cardinal Glennon Children's Foundation.